My name is Liz Powell. I am the founder of Women's Health Advocates as well as G2G Consulting, which stands for Government to Growth. I'm a lobbyist in Washington, D.C., and I have an amazing team that is helping us put together these monthly calls. Our founding leaders are phenomenal. I hope that you will check them out on our website, and I hope that you're going to our website to get updates, womenshealthadvocates.org. So today we're going to do some updates. Next slide, please. Updates on what is happening in Washington. There's a little thing called a shutdown going on. We're going to talk about what that means for all of us. And then we're going to share some rays of hope, I call them. There's some actually very promising language and funding levels in our appropriations bills that are under consideration right now. And then we're going to talk about some recent events that we've done that were very energizing. Our women's health advocates are amazing. And we'll close out with our asks for all of us to engage in this advocacy effort and then take your questions. So next slide, please. So the government shutdown, what is it and what does it mean for women's health? So I would like to bring on our expert, brilliant colleague of mine, Katie Collins, who used to work in the White House and has been a lobbyist for health issues for many years. She's quite the expert. So would love to pass to you, Katie, if you wanted to give that rundown.
Thank you, Liz. I appreciate it. And I apologize for being off camera. I've been at the dentist this morning, so my apologies. But I'm sure folks have seen in the news that at midnight last night, the government shut down at the end of the fiscal year. This is the first shutdown since 2019. And this happened after Congress failed to reach an agreement on funding the government for fiscal year 26. You might have heard that the House, so Republican majority, had passed what they would call a clean stopgap. So that means really no policy riders to extend the government at current funding levels for the next 7 weeks until November 20th. The Senate did not pass a stopgap after Chuck Schumer, the Senate Majority Leader, faced a lot of scrutiny for backing down last spring in the funding discussions. He is holding firm, demanding that the Affordable Care Act subsidies be included in a funding extension. From conversations that we've been having on the Hill, we understand that Republican leaders, many of them actually, are open to negotiating on extending Obamacare tax credits, but they don't believe it should be part of the government funding fight. So here we are in a shutdown. So we wanted to talk a little bit about what does this mean for our health agencies. So about 32,000 staffers from across the health agencies will be furloughed, which is about 41% of HHS's workforce. So just to tell you what that means, the FDA will continue to work. They will have the most staff, about 86%. 2/3 of CDC staff will be furloughed. So they will continue work on what they consider to be urgent health issues, but will not work with state and local health departments on data sharing, on, quote unquote, less urgent issues like HIV, opioids, diabetes, those sorts of things. And they will not be communicating health related info to the public. So that goes away. And then when it comes to CMS, Medicare and Medicaid are considered mandatory and will continue. And then at NIH, we will see, some things continue and some will not. So a lot of the fundamental research will pause. Other things will keep up. So we will feel an impact. Federal employees will not get a paycheck. They should get their, first paycheck next Friday, their first paycheck under the shutdown. That won't happen unless we see the government reopen. So kind of what happens next in terms of who will cave. And I think right now we really don't know. Everybody's kind of dug in their heels. Republicans have said that they will not negotiate while Democrats keep the government shutdown going. Chuck Schumer has said that unless there are serious negotiations on extending Affordable Care Act subsidies, that he will not cave. I think the one potential wild card in here is President Trump, who has expressed some interest in kind of being the savior of the subsidies, understanding that healthcare is an important issue for Americans. So I think one potential could be if he decides to tell, Senator Thune and Speaker Johnson that he wants a deal. Otherwise, it's hard to see exactly where this ends. So we'll be keeping close tabs on this and we'll be sharing updates as we know more. So today's day one, and that's where we stand.
Thank you, Katie. I appreciate that. Next, I wanted to share the appropriations numbers. So right now, today, October 1, is the start of the new fiscal year. And they, as Katie said, they couldn't come up with an agreement, so we're in a shutdown. However, the House and Senate have both drafted their versions of appropriations bills. And the health funding bill is the one we really care about. We care about the others too, but limited time. So we're only going to highlight these. I wanted to put this up so you could see the difference between the House bill and the Senate bill when it comes to the health funding programs that we care about. And notice that considering the president put out a budget proposal that would be a 40% cut, look at these numbers. This is actually not bad. Clearly, the Senate has better numbers, right? They're like all increases or level funding, except for CDC and the Senate side. On the House side, we see a few more cuts, but they're small cuts. $7 billion cut to HHS, $500 million cut to NIH, as compared to what it would have been, is actually a success. So I think it's important for us to see that our advocacy is working. Now, I would not take 100% credit, but I will say, you guys kick ass. The fact that you sent 1,000 letters within 1 month of us creating that online advocacy tool speaks volumes. And at this point, we're up to like 2,000 letters. I actually have to look at the total number. But your letters are helping. Your trips to Washington to come participate in our Capitol Hill days, it is sinking in. And then all the follow-ups and the back and forth that we have with the staff is all working. And we lobbied like crazy at the beginning of the year to make sure that like the Office of Research on Women's Health, which is that ORWH line, that office received an increase, and it worked. Look at the funding levels. We also lobbied to get language, and I'm super excited because I really wanted that definition of women's health in legislative language, and it's actually in the House bill. And that definition of conditions that solely, disproportionately, and or differently impact the health of women head to toe throughout the lifespan. That definition is in that bill. And think about the impact of that. With that as the adopted definition, that means that all programs have to use that definition. So it's a big step forward. The other things that are in this bill that I didn't include in this slide, but in particular in the Senate, they mentioned the Sprint for Women's Health program, and they provide a directive around continuing that program. So that would be huge. That was that 110 initially. Now I think it's up to 113 million that was dedicated to women's health research. So that's another big step forward. Other language in there about reinstating all those grants that were terminated. And remember, we at Women's Health Advocates made a list of all the 800 grants terminated by NIH, which ones impacted the health of women. And that was a 2-page list that we handed out on Capitol Hill on our Capitol Hill Day. So having all those reinstated would be huge. And even if they're not, the fact that the Senate's willing to push back is a sign that they are willing to go to bat for that. Other things in there, like the need for clinical trials that are representative of the disease impact in certain populations. So explicitly says we need all Black participant clinical trials for certain diseases and conditions where it's disproportionately, overwhelmingly impacting Black population, for example. Same with women, same with these other, more representative clinical trials. So there's lots of good, positive language in these bills. And I really want that to sink in for you because I think it's important that we all have hope right now. And when I close out with my ask, it's going to make sense why I'm asking you to send letters, because this can make a difference. Okay, next slide, please. All right, so our own updates. Next slide, please. I have been traveling and seen many great things. So Pittsburgh, we did a happy hour, and then we went over to the Women Who Rock, where they very graciously gave us a table for free to put out and build more support for women's health advocates. And we had a great, we were able to attend this concert where Jessica Simpson was the main singer, but they had several bands, all women bands, kick off the night. So it's a very energizing night, lots of pink, lots of people dressed up, wearing all kinds of t-shirts around women's health equality. So it was really cool. And so this What's Our Why campaign is going crazy. It's super popular. And we've got lots of people that want to stand up and say, what are the issues they care about? Why are they involved in this effort? And so these are just some of those pictures just to capture that moment. Next slide, please. This is our event in the Bay Area, just south of San Francisco, in the home of Kavita Bhutknight, who was an amazing host. Our main sponsor was Wilson Sonsini, thanks to Eva Yen. And these were amazing speakers. Again, we did What's Your Why campaign. Lots of different folks. We had some great breast cancer early detection coalition advocates there at the event. So we wanted to highlight some of those, but just a really great energizing event with a lot of good discussion. We had speakers that were very insightful, but then we also were able to have audience participation. And so I tried to capture that with some of these pictures. Next slide, please. And then on to Detroit. And Detroit was just recently, last week, and it was awesome. Not only for the event and the amazing speakers, just like these other events, and the dialogue and again, what's your why, all very compelling. But then the next day we went and toured the Detroit Birth Center, which was this amazing facility that is enabling women to have full control over how they want to deliver their babies, how they're cared for. It is very patient-centric, women-centric organization and super impressive. So that's that picture on the bottom left. So I wanted to highlight that. The other thing that was distinctive about this event is if you see in the middle on the wall, Katie Kirsch was our main organizer leader of this event. She did a phenomenal job, and she had this great idea of having people write down, how can we reframe women's health as not a niche issue, for example? What policies need to change in Detroit? She had a bunch of these signs throughout the room, and people were really engaged. They took the time to write down what they thought, and it led to some really interesting discussion. And Katie's so on the ball, she's already sent the follow-up email to move on to next steps and get people organized. So super, super impressed with that. All right, next slide, please. Let's move real quick through our what's our ask of you. So we want you to write letters. So we have top priority right now is appropriation. So again, I thoroughly talked through what we see in those bills. It's really important that we send these letters in to say the importance of funding these women's health programs and keeping the women's health language in the bill. So please send that letter and take that extra 2 minutes to personalize it and say, if you're a patient, a doctor, a CEO, a founder, an investor, a researcher, a loved one, whatever your angle is, share that and just know as a constituent, your voice really matters. So write a letter to your member is super easy. You just go in and put in your address and it will pop up who your rep is and the 2 senators, and the sample letter is there. So you could go right now if you wanted to and send your letter about appropriations. And then once you're done with that, you can go back and send your letter about the Find It Early Act. I'm going to close out with a little more information on the Find It Early Act, but those are our 2 priorities. Next slide, please. Okay, we'd love for you to come to events. Come to multiple events. I know some of you have been flying in and coming to multiple events, which is great. Sunny, for example, I've loved seeing you at a couple different cities now. So Chicago is coming up tomorrow. Super excited. We've got a packed room, great turnout, amazing organization. Our volunteers on the ground in Chicago are just truly inspiring, amazing group of people. I'm just so honored to be working with this team. We've got, a famous actor as our keynote speaker. And then we've got these amazing experts in women's health. So that'll be a really great discussion. And we are honoring October Breast Cancer Awareness Month. One of our speakers is a breast cancer surgeon and expert. So we definitely wanted to call that out. We're also talking about menopause, which is super popular, by the way. Our menopause congressional briefing, well over 500 people. I did the follow-up communication and then got even more response back from congressional offices who want to work with us on menopause legislation. So Claire Gill, who is one of our steering committee members and heads up the Menopause Foundation. She and I have been teaming up on some of that work. So just know we are having a huge ripple effect when we do all these things. Okay, Boston's coming up October 17th. That one is going to be focused on innovation, investment, and policy. Los Angeles is going to be a happy hour reception. Although it's more than a happy hour, it is an amazing gathering. I think it's going to be very classy and fun. And big props to Sandy for taking the lead on that. Sandy Gleestein is really taking the lead on hosting us. And then also Shannon, Susan, and Nassim are leaders of that. So thank you for that. New York is coming up on October 30th. And I'm really excited because Seema, Felicia, and I are going to team up and do a deep dive on policy. All of us have, the three of us have decades of experience in policy working in Congress and in NIH. So we're going to share what is going on and what we can do about it. So I think that'll be a really distinctive, interesting event. Los Angeles will be a luncheon focused on investment and innovation. We're going to have a showcase of these different investors or different founders who are running amazing companies in women's health innovation. And we're going to have expert panel discussion. So it's going to be really engaging. And I know some of our steering committee members are already on it, which I really appreciate, and serving as some of our speakers. So big thank you again to our Los Angeles team, and in particular, Maria DeSantis has taken the lead on that and done a phenomenal job. Philadelphia has just been getting organized recently, and we've picked December 5th for our breakfast event. So more details to come on that. Also not on here, but very important, Southeast. Women's Health Advocates Southeast region is teaming up a few different states. I think we're going to start with a webinar and then do some in-person events. Nadia Richardson was just texting me this morning about what she wants to do. So super excited. So there'll be a lot happening there. Linda Goller-Blount, also one of our leaders, is helping to lead that effort, and several other amazing people. Okay, next slide, please. All right, you could join a committee. So our regional committees are getting really active. And before the end of the year, I want to do one meeting of our regional leaders so that people can learn from each other. I have to say I learned things, for example, with the San Francisco team led by Allison Lewin, phenomenal leader. We learned things that then we applied to Chicago. And so then we're now going to apply them to Philadelphia and to like other places. So I think it's really valuable for the leadership to know each other and to help ensure that when we do these events, that we're not reinventing the wheel. So we're going to organize an event of our regional leaders. That's coming soon. Anyway, endometriosis, maternal health, CMS reimbursement, breast cancer early detection coalition, and more to come. If you're interested in any of these committees and you're not on the list yet, we've started to have some organizing meetings. Just send an email to us at info@womenshealthadvocates.org. Next slide, please. Join our steering committee. We still need more people on our steering committee and to be sponsors. It's really important. Our steering committee, these are just the powerhouse, the most impressive group of people I've ever met. All leaders in their field, whether they're on the investment side, CEO side, research side, clinician side. It's just an amazing group of people, amazing patient advocate leaders. So would love to have more people on our steering committee just to help run the organization, provide that direction, serve as speakers to events. You get to go to all events for free. So we really want to build up our steering committee. And then sponsorships, we're finding that sponsorships for these events is super helpful. That helps us raise enough money to keep this going. So if you have suggestions on sponsors, please send that in to me. We do have Vanessa on our team taking the lead in organizing an amazing list that Carolyn, Sue, and Allison Ross Powers created last year that we worked on together, but they really deserve a lot of the credit for building that list. Smita Azrani, also one of our leaders, has taken a role in making sure that we are building an effective list. So we're going to start going after these potential sponsors this fall so that we can get into their budgets for 2026, because that is something that we've heard repeatedly, that's really important. Some of these last minute requests were hard to do because we weren't already in their budget. So welcome advice, insights, connections for that. Next slide, please. We want you to keep engaging in what's your why, sorry, but it's our why, all of us. So, you can go to this link, you can then pop in your headshot and then add your quote as to why you are involved in Women's Health Advocates, why you care about women's health. You can do it more local level, why you're involved in your region. However you would like to comment, we welcome it. And we want to make sure that we're liking, commenting, and reposting. Next slide, please. So the Breast Cancer Early Detection Coalition is doing a big push for the Find It Early Act co-sponsors. And so what we're going to do are Zoom calls in the month of October with our own members of Congress to talk about the importance of this bill and why we want them to be a co-sponsor. The way it works is if the bill is in the House side and you are a Republican, then you ask the Republican House member. So in this case, Fitzpatrick. If you're a Democrat in the House, it would be DeLauro. And if you're in the Senate side, if you're Republican, it would be Roger Marshall. And if you're a Democrat, it would be Amy Klobuchar. That is how it works. So what we're going to do is we already did one planning call. Now that we're in shutdown, we're going to see how long the shutdown goes. But we have another planning call coming up October 7th, just to plan out and coach and sort of give you some training on how to do these Zoom calls. What we'll do is we'll give you instructions on how to reach out to your member of Congress's health staffer and ask for a meeting. And then we're going to give you a PowerPoint that you can use when you do the meeting. So we'll make sure that you have everything you need, but would be really awesome if we had like 50 different meetings happening during the month of October, all about this bill, pushing people to be co-sponsors. I think it would be really impactful. We had some good calls with the staff. We're continuing to coordinate with the staff for all of these offices. And Fitzpatrick in particular, his staffer was like, give me the names. I'll do proactive outreach. So I think they're very motivated to try and get as many co-sponsors as possible. The other distinctive thing is while the Senate bill has already been introduced, the House bill has not. And that House bill is going to be introduced this month during October Breast Cancer Awareness Month. And people can be an original co-sponsor. So that might be an additional sort of asterisk reason why a member of Congress might want to get on right away so that they can be an original. And that means that, you know, you get more media coverage when they introduce the bill. It's like there's a lot of benefits to being an original. So we want to make that as part of our argument. Okay, so that's what we're doing for breast cancer. Next slide just summarizes all the things we'd love for you to do. So send a letter to your member of Congress, come to an event or events plural. We'd love to see you all over. Join any committee, join the steering committee, post your what's your why and tag us, and then engage in our October Breast Cancer Awareness Month Zoom Hill meetings. And that is it. We can take down the slides and take any questions. Happy to take, oh, there's a Q&A box. Can you film the New York policy or make it open via Zoom streaming? We will look into that. It is an event. I don't know. Let me see if we can do any kind of recording of it. We are trying to raise money. And if you notice, hopefully someone posted in the chat box all the Luma links. Some of these events are free and they're more like a happy hour gathering. Some are fundraisers, and we're trying to raise money for us to be able to keep doing this effort. So keep that in mind. So for the New York event, we are charging a fee for that one just to help raise money for the organization and pay for us. So Felicia and I are taking a train or plane up to New York for that event. And so there are expenses to running the event, obviously, and then the breakfast. We are working to hopefully get, it looks like we're going to get a sponsor to help pay for it, but we'll see. So just note that. So that makes it hard to record things and then offer that for free when other people paid. So, but I will look into it. I'll see if we can record that. Okay, so I see more questions here. Does Congress stop working under this scenario? So every office is up to their own policy for how they want to handle it. When I worked on the Hill, I always went in when we had a shutdown. We did have shutdowns in my day. I even was there during anthrax, and we couldn't go to the Capitol Hill. We had to go to agency offices, but they only had the chief of staff and the legislative director considered essential and had to go in then. So some offices might do that where they only have the chief of staff, the legislative director, maybe the press secretary, but no one else goes in. Other offices say, screw it, you're all coming in because eventually you're going to get paid anyway. So we'll see what that means, but usually they are not going to do meetings, which is why we've been a little bit on hold with our breast cancer awareness month Zoom Hill meetings. Like we can't really schedule those now. I think we're gonna have to wait a week and see what happens. Hopefully the shutdown will end within a week, but I'm actually nervous that shutdown is going to go on for a few weeks. So we'll see. But so yeah, so some people are still working, but like I said, it's individual office how they handle that. Are you looking for steering committee members for Women's Health Advocates, Breast Cancer Early Detection Coalition, or both? Well, it's a twofer actually. So some people have signed up for the Breast Cancer Early Detection Coalition, and that is what they care most about. But they are invited and welcome to participate in Women's Health Advocates. Others, they care about both, and so they want to be on both Women's Health Advocates and the breast cancer one. So it's really up to you. Once you join at steering committee level for either one, you are invited to all of those calls and events, etc. So. Let's see, next one says, are there efforts for any bills awareness efforts at the state legislature level? That is a great question. And so here's the deal. I would like to get into state work. I also would like to get into global work. We have several countries who are signed up for Women's Health Advocates, and people keep reaching out to me on LinkedIn. So I definitely want to get there. This first year, though, we really wanted to focus on Congress and the federal level. But our vision for next year is to be able to create model state legislation and do a couple state house days where people can go and push on that local level, because we are seeing progress. I mean, look what happened in Rhode Island with the recent menopause bill that became law. So there are things happening state level, and it's a great way to be an advocate. So yes, we will get there next year. Is the Breast Cancer Early Detection Coalition call next week on the 7th or 8th? I have the invite for the 8th. Great question, and I know it's confusing. So on the 8th is our normal monthly call where we will give updates on Washington and updates on what the Breast Cancer Coalition is doing. On the 7th, the day before that, it's training just about the Zoom Hill meetings that we're setting up. We're going to show you how to set up those meetings. We are going to show you the slides that you're going to use in those meetings. So it is only focused on that. What is essential is for people to sign up. Even if you're maybe not even 100% sure, please sign up. We have a Google sign up link that we really need people to sign up for, so that we know that you want to participate, and so that we can look up your member of Congress. We want you to be sending a request to do a meeting with the right staffer, but we can't get you the right staffer unless you sign up. So I'm going to put it right here, right now. Please sign up for this. That's the link right there. Okay. So if you have any interest in participating in any Zoom Hill meeting for Breast Cancer Awareness Month, please use that link and sign up, because otherwise we won't know who you should send your meeting invitation to. So it's really, really important. Okay. Okay. Next one. It feels like metastatic breast cancer also needs funding. I'm learning that 30% of cancers that are caught early still go on to stage 4. Crazy. Is there a reason to only focus on breast cancer detection, or can we also focus on stage 4? 100%, 100%. We definitely care about that. And Sally on our team is like a huge advocate in that space. And we have a list of 7 bills that we are promoting. I'm going to quickly do screen share so you can see that that is definitely one of the bills here real quick. Screen share. Can you see that list of bills? So metastatic breast cancer access is one of those bills. That is something that we lobbied for on July 16th on our Hill Day, and something that we continued in our follow-ups. That is definitely on our list. It's just the Find It Early Act is the most comprehensive of all the bills. So that's why. Okay. Okay, I see we're at time. If possible, can we get a copy of the chat via email? There's a ton of information on collaboration. Yeah, I think I could do that. Yeah. When we'll fill out the form? Is it otherwise confidential? Oh yeah, I can keep it confidential. I won't share it with anyone. It's just so that I can look up, or my team probably, so it might be not just me, but my team would see the address, just so we can look up the right member of Congress. And then we have a service under BGov, Bloomberg Government, where we can look up the name of the health staffer and their email address. So that's what we would use it for, but we won't share it with anyone else. So completely understand privacy. Okay, so I think we're done. I'm going to post it one more time because I really want people to sign up. Oh, 2 more questions popped in. Is there a steering committee call today? Yes. Yes. There is a steering committee call. I did send out the link. I'll email it real quick to everyone on steering right now, just to make sure you have it, but you should have gotten a calendar invite with that. And unless anyone has anything else, I think we're at a wrap. Okay. Thank you all. Thank you so much for dialing in. Thank you for being an advocate. We really appreciate you. And steering committee folks, I will see you in a second. Bye.